Dysfunctional uterine bleeding is abnormal uterine bleeding due to the hormonal imbalance without any structural pathology. Now classified under the AEB, ovulated dysfunction in the fecal-palm coin system, and ovulation, most common cause, unopposed estrogen leads to the endometrial overgrowth, irregular shedding and bleeding. Fetal phase defect, inadequate progesterone production, hypothalamic pituitary ovarian axis immaturity or the dysfunction, adolescence, perimenopausal women. Common causes of the rebirth, physiological, adolescence, perimenopause, endocrine disorders, PCOS, thyroid dysfunction and the hyperprolactinemia, obesity, increased peripheral estrogen conversion, stress, excessive exercise and the eating disorder. Clinical features like irregular heavy or the prolonged menstrual bleeding, amenorrhea followed by the excessive bleeding due to the anovulation, no pelvic pain or the structural abnormalities. Diagnosis: exclusion of the other causes, rule out the pregnancy, beta-HCG test. TSH, hypothyroidism, prolactin, hyperprolactinemia, FSH and LH, PCOS, ovarian insufficiency, coagulation power, bleeding disorders. Pelvic ultrasound excludes the fibroids, polyps, endometrial hyperplasia. Acute heavy bleeding, high dose estrogen, IV conjugated estrogen or the oral combined OCP. Tranexamic acid, antifibrinolytic, hormonal therapy OCP, regulate the cycle, reduce the bleeding. Progesterone therapy, medroxyprogesterone acetate, norethiosterone for the anovulated cycle. Levonorgestrel, IUD, Mirena reduces the bleeding. Non-hormonal, tranexamic acid, NSAID. Surgical option, endometrial ablation for the refractory cases, hysterectomy, last resort. DB is an abnormal uterine bleeding due to the hormonal imbalance without the structural pathology, and ovulation is the most common causes leading to the unopposed estrogen stimulation. Common in the adolescence and the perimenopausal women. Diagnosis is by the exclusion rule of the pregnancy, thyroid disorder and the coagulopathy. Pelvic ultrasound is done to exclude the fibroids and polyps. Endometrial biopsy is needed if age greater than 45 or the risk of the endometrial cancer. Acute heavy bleeding, high dose estrogen or the OCP, tranexamic acid. Chronic treatment OCP, progesterone, levonorgestrel, IUD, NSAID. Surgical operations like endometrial ablation or the hysterectomy for the refractory cases.